Good day, class. This is Dr. Darren Carpenter, and I will be giving your class today, and it's on safety and infection control. In this class, we're going to have four main sections that we will cover. These are contraindications, precautions, the management and prevention of accidents, and infection control. So our first section is contraindications. And what does this term mean? Well, a contraindication is a condition or a factor that serves as a reason to withhold a certain medical treatment due to the harm it would cause the patient. So a great example of this is pregnancy. And in this case, pregnancy is the condition, and the following 3 points are the treatments that we withhold because they increase the risk of either injuring the baby or causing premature labor. So what are these 3 points? The first one is that we do not perform acupuncture, moxibustion, and cupping on areas of the lower abdomen and the lumbosacral region during the first trimester. And then the second point, which is also partly accompanied with the first point, is that we do not apply acupuncture onto the upper abdomen as well as the lower abdomen and lumbosacral region after the first trimester. So that's the first 3 months of pregnancy. And then the third point is that the following acupuncture points are not used in pregnant patients. And these are Hegu, large intestine 4, Sanyan Jiao, spleen 6, Kunlun, bladder 60, and Jiyin, bladder 67. And the reason why we don't use these points is that they are very strong at activating blood circulation and moving qi, which can then cause the patient to go into labor. You must note that we can use these points if we had a circumstance where we wanted the patient to go into labor. And our second contraindication is what we call prohibited areas. These are areas of the body which we do not needle in patients. The first one is in infants, and this is the points on the top of the head, as the fontanelles may not yet be closed. So when do these fontanelles close, and thus it can be safe to needle? Well, the 2 main fontanelles are the anterior fontanelle and the posterior fontanelle. And the posterior fontanelle closes 1 to 2 months after birth, and the anterior fontanelle closes between 9 to 18 months after birth. And then it will be safer to needle these points. But normally in infants under 2 years, we do not perform acupuncture because infants are unable to cooperate with the practitioner. So if we retain the needles, there's a chance that they might move or bash the needles. And they are also very young and their qi is not yet strong. So we much rather prefer to do acupressure on infants under 2 years old. And then the second prohibited area is in all patients, no matter their age. And this is that we do not needle the following areas. These areas are the external genitalia, the nipples, the umbilicus, and the eyeball. The next contraindication is that we do not needle areas of the body with either infections. So here, if you look at the top image, you can see an example of an infection. And what we would do is we look at for the red area that is around the wound, as I've highlighted here, and we would not needle in any of this area. And then secondly, skin allergies. So this can often look similar to infection, but there may also be scaling, dry skin, flaking, and stuff like that. And then we'd also not needle into those areas. Thirdly, ulcers. This is my bottom image. So yeah, we would not needle into the ulcer, but we'd also not needle into this red area around the ulcer that I'm highlighting. And then also scarring. So we also try not to needle into scars, as this can be quite difficult and quite uncomfortable for the patient. So if you look at my image in the middle, you can see this central scar here that I've highlighted is actually along one of our meridians that we use. It's known as the Rin Meridian. And if you were trying to needle one of these points, it would obviously lie where this scar is. So what would we do then? In that case, what we would do is we would either select an alternate point or we'd have to insert away from the point. And then two other areas that are contraindicated. This is skin tags or moles and anywhere where there's a malignant tumor. Okay, so as we said, you would, if you found one of your points had any of these, you would then select an alternate point, or you could insert away from the point and angle it back in. But this is only applicable for areas with scars or skin tags and moles. We can't use this technique on infected areas or ulcers and such. And then our final contraindication is to do with the syndrome the patient is presenting with. And this is very specific to Moxibustion and cupping. And what we do is we do not perform Moxibustion or cupping on patients with either excess heat syndromes or with fevers due to yin deficiency. Okay, and then our next section is precautions. And the difference between a precaution and a contraindication is that in precautions, we can still perform the treatment, but we must be much more careful when we're performing this treatment. And as you can see, there are a number of different occasions where you must be extra careful when performing treatments. The first of these is the patient's condition. So it is recommended that we apply few needles or delay giving an acupuncture treatment to patients who are famished, which means they are excessively hungry, or have overeaten, are intoxicated, or overly fatigued, which means excessively tired. So what happens here is that we have to use a number of different factors before we decide on what we're going to do. So as you can see, any of these can have a wide variance. If we look at being famished, it can either be 1 or 2 hours, 3 or 4 hours since they've last eaten, or it could be 1 or 2 days. So you would take into how severe their condition is, and you'd combine that with your overall evaluation of their body condition, and then you would decide whether or not you were going to give few needles, or if you think it's a severe condition, then you would delay the acupuncture to another time. The second precaution is for those with chronic or severe illnesses. So what will happen here is that in these cases, you would first determine the patient's condition. And here you must use the techniques discussed in your diagnostic lectures to determine their overall condition. And then this combined with what type of chronic illness they have would help you to evaluate their overall condition. And then if you've determined from this that the patient has a weak constitution, what we would do is we would use less needles. We would also not perform any strong manipulations on those needles. And finally, we would try to treat the patient in a lying position, as this means there's less likelihood for complications. The third precaution is patients that have bleeding or clotting disorders. And some common disorders that you'll see in clinical practice are hemophilia, von Willebrand's disease, and vitamin K deficiency. You also need to be careful of patients who are taking blood thinners, as they can have similar effects as these patients with the bleeding and clotting disorders. And some common blood thinners are warfarin and heparin. And patients that normally are on these type of blood thinners can be patients that have had strokes or that have had any type of heart disease. So you must also be aware of these patients. And if you have determined that your patient is one of these at-risk patients, then what we do is we more carefully select points, and we do not use any points that are close to large blood vessels. And why do we do this? Well, because these patients have a problem with their clotting, it means they're much more likely to develop complications if we do happen to puncture one of their blood vessels. So therefore, they might more easily bruise after acupuncture treatments. And if you hit a major blood vessel, they may not stop bleeding and be required to go to the hospital to stop the bleeding. And with this, an important test to know is known as Inr Test, which stands for the International Normalized Ratio. What this basically is a test that determines how quickly the person's blood clots compared to the average individual. So values of 1 to 1.25 means that their blood clots normally, whereas values of 2 to 3 means it takes much longer to clot than average. And that's what the the target reference is for patients on warfarin. So how this would help you is that patients with a value around 1 to 1.25, even though they have these bleeding disorders, are at much less risk than patients whose levels are much higher. And if their levels get high enough, above 4 or even above 5, we might even consider not giving acupuncture until their levels come back down to closer to the normal range, as obviously these higher levels put them at much greater risk for bleeding, for uncontrolled bleeding. Our fourth precaution is related to the previous one, and this is around blood vessels. So when needling, we try to avoid blood vessels wherever possible. And this is not just in patients with bleeding disorders. This is in all patients, as we do not want to cause unnecessary bleeding. So how do we do this? Well, the first and most easiest way is to avoid the visible blood vessels. And these are the ones that are in the arms and legs that we can easily see and are close to the surface. The second way would be to avoid the palpable blood vessels. These are the blood vessels and arteries that we can feel, such as the radial artery on the arm, the carotid on the neck, and the femoral. And by palpating them, we will know exactly where they are and then can avoid them. The final way, and this is for ones that we cannot see or palpate, is that we have to use our knowledge of surface anatomy combined with the theory that I teach you of individual points and what lies around these points to help us to avoid the arteries. And as you can see, I gave you an example here in the picture of one of the points we have learned. This is spleen 12, which lies very close to the femoral artery and nerve. And therefore, when we needle this point, we have to be extra careful to try and avoid hitting this artery or nerve. Our fifth precaution is when not to perform a deep insertion. So normally the general rule is that we do not do deep insertions anywhere on the body which is close proximity to a vital organ. So for instance, the regions such as the chest, rib and upper back, which is close to the lung, the lumbar region, which is close to the kidneys, the abdomen, which is close to the spleen, liver and bladder, and then any areas that are close to major arteries, such as the neck and the carotid, or the spleen points which are near the femoral artery. What we would do in all of these points in these locations is that we would definitely not do a deep insertion. We'd either do shallow insertions or we wouldn't do a perpendicular insertion. As well as specific areas, there are also specific points which we do not do deep insertions on. These are points such as Yamen do 15 and Feng Fu do 16, which are both near the medulla oblongata. That's the image on the top left. Then Jingming, bladder 1, and Chengqing, stomach 1, which is near the eye and its blood vessels. Those are the bottom two pictures. And then Tian 2, Ren 22, which is in front of the trachea, and that's the top right picture. And some further points are Renying, stomach 9, which is near the carotid artery on the neck. And here we have to be careful of this point, but also other points around the neck region. Then Jimen, spleen 11, and Chongmen, spleen 12. These are both near the femoral artery, and spleen 12 is the one I talked about 2 slides back. Another one is Taiyuan, lung 9, which is near the radial artery, and then Jiuwei, which is Ren 15, and that is near the heart and liver if they are enlarged. The sixth precaution is patients which are at an increased risk of infection. This can be either due to conditions such as diabetes, which increases the amount of sugar in their blood, and thus it's easier for bacteria and viruses to grow, or they have a reduced immune system, either from viruses such as HIV or AIDS, or due to drugs such as corticosteroids. And what you have to do with these patients is you have to be extra careful when you're doing your hygiene protocols, as you do not want them to gain an infection from your treatments. The seventh precaution is poor circulation, and this is related to increased risk of infection, as poor circulation can increase the patient's risk of infection, as well as it also means that they will take longer to heal should you accidentally injure one of their blood vessels. And normally what we do in these cases is we try to avoid needling areas of poor circulation. These are areas with varicose veins, dry skin, flaking skin, or slight purple tinge to the skin. And the eighth precaution is related to moxibustion. And when performing indirect moxibustion, one should prevent burning of the skin. And how this is done is that we get feedback from our patient as to when they start feeling burning sensations, and then we reduce the intensity. The second type of moxibustion is known as scarring moxibustion, and this is performed by burning the skin as to result in non-bacterial suppuration. And this technique can only be performed after fully explaining what you will be doing to the patient and getting their consent. And when performing scarring moxibustion, we do not perform it on points of the face where there are large tendons or blood vessels or near joints, as obviously there's going to be scarring and there's going to be a wound, so we do not want it somewhere that is difficult to heal. And then also you need to take special care with patients that have reduced levels of consciousness, because they can easily move while you're performing the treatment and get burnt, or performing this on areas with purulent dermatitis or areas with impaired circulation. And these two relate specifically to scarring moxibustion, as there will be a wound. So we do not want any type of condition that can cause this wound to get infected or to take extra long to heal or become an ulcer. Our final precaution is related to cupping treatments. And when we perform a cupping treatment, we try to select muscular areas which are free from hairs or bony ridges, as hairy regions find it difficult for the cups to stick, and the bony regions can be very painful if you cup on these regions. The second thing is we try not to cup areas where there are ulcers, edema, or large blood vessels. And thirdly, we do not place the fire, and by fire I refer to this image here. You see this flame here. We do not keep this flame above the patient, as if it is above the patient, there's the risk that a piece of the flame or a piece of ash may fall off and burn the patient. And then we also do not apply cupping to the sacral or abdominal areas in pregnant women. And after the cupping, there will be bruising or blood stasis, which should resolve in a few days. And you may also find small blisters, which should also resolve in a few days. And then if there are severe blisters, this indicates that your strength of cupping might have been too strong, and then we may need to drain the blisters and dress it with gauze, or refer the patient so that they can be drained and dressed. So we will now move on to the third section of the lectures, which is around the management and prevention of accidents. So here on the left, I have listed all the possible accidents that can occur during an acupuncture treatment. And I've also tried to list them according to my own experience and how often they would occur. There are one or two things you must take note of. The first one is that fainting and dizziness, and the second point, pain. Well, these two could be interchanged because pain may be more often than fainting and dizziness, especially if you include the chi or the chi sensation as part of pain. But I exclude that because that you would expect every treatment, because that's one of your goals. I term this pain more a prolonged, sharp, severe pain that is related to the manipulation or the insertion or removal of the needle. And then moving on, so fainting is therefore would be the most common, and then would be pain. Then I've put stuck needle, which has happened a few times. Hematomas, it's only happened really once to me. Many times patients bleed or have a bit longer bleeding, bleeds for 15 to 20 seconds, maybe even a minute, but very seldom does it leave a bruise. Only once has it ever happened to me. Bent needle, I've also only ever happened once. And then all the ones below this, all the ones from here down, have never happened to me. The broken needle, infections, convulsions, fortunately I've never had these happen during a treatment. And as long as you guys are careful and you follow the correct protocols, you should also have none of these occurring to you either. So let's move on. So let's begin with fainting and dizziness. So this is obviously a sensation that's felt by the patient, either that they're going to fall over, or that they feel unwell, or they feel like the room is spinning around them. And there are multiple different causes for this, and sometimes in a patient who experiences this, it might be difficult to pinpoint which one is the cause. But some possible causes can be nervousness, a weak constitution, hunger, fatigue, improper position during the treatment, like you're treating them sitting up instead of lying down, or you perform too strong a manipulation. And then the manifestations, so how you would see that this is occurring, is that during the or after the treatment, the patient will feel dizziness, vertigo. So dizziness means they feel like they're going to fall over or like they're going to pass out, whereas vertigo is the spinning of the room around them. Or they could have palpitations, which is the fast heartbeat. They could be short of breath, fidgeting, nausea, pallor, the cold sweats, and a weak pulse. And then there also may be a drop in blood pressure and unconsciousness, and they might even become unconscious in a severe case. And then I had experience of this right in my 4th year. When I initially went through this section of notes, I felt that fainting was not a serious condition. It was something that people often get, and it's not something you had to worry about. But in my 4th year, I was proved very wrong. What happened was we had a patient who came to see us, and in our 4th year, what happens is you just observe patients, and the 5th years do all the consultation and the treatments. We just observe and write down what we find. So during the consultation, it all happened nothing unusual. The patient was a little bit nervous as it was their first treatment. And their constitution was slightly weaker because they did present with a chronic illness. But yeah, other than that, there were no other warning signs. So we continued with the consultation, and then we moved on to the treatment. And yeah, the doctor, the 5th year in charge who was seeing the patient, performed the treatment. And then he did acupuncture, and he put on the electroacupuncture, and then he had finished and he went on to the next patient, and we were left to watch over the patient. And about 5 or 6 minutes into the treatment, we noticed that the patient was starting to fidget and they were starting to moan a little bit. This is quite a warning sign because you don't often see this during a treatment. So me and my colleague who were observing, we quickly went to the patient to see what was going on. And when I got near to the patient, I realized that they were sweating slightly, so they had some sweats on the face, and that they were fidgeting and obviously moaning, and then that their face was very, very pale, so the pallor. And it's a difficult thing to describe, but this pallor, it makes it look like there's something seriously wrong with the patient, almost as if there's like no blood left in their face, which can really freak you out if you haven't seen it before. So obviously, we being 4th years, we both were quite stressed when we saw this happening, and we didn't know what to do. Fortunately, we just went quickly to our supervisor to tell him what had happened. Lucky for us, he knew exactly what to do. So what we did is, on the next slide, this is the management. So what we had to do with this patient now is we had to quickly remove all the needles from the patient over there, and then we had to then we were sent to go fetch some warm water, and we added a bit of sugar into the water and gave it to the patient. Obviously the patient had we raised their head to give them the water, and then we put them lying down and left them for about 10 to 15 minutes until they started to feel better. And fortunately for us, the patient did feel better about 10 or 15. I think it was like 12 minutes or so after we left them lying. And then after we had finished this, we further questioned the patient to find out why this had happened. And just before we get into that, let's just look at the management in a bit more detail. So if you did well like we did and you had done all of these procedures and the patient was still not improving, then you have the option of doing a treatment, which we prefer to do pressing because obviously the needles is what has caused it, but you can needle as well. And we needle specific points such as Ren Zhong, do 26, Zhu Liao, do 25, Nei Guan, pericardium 6, and Zhu San Li, stomach 36. And then we also provide Moxibustion on Qi Hai, which is Rin 6, Guan Yuan, Rin 4, and Bai Hai, do 20. And if after this treatment there's still no improvement, then I would advise you to call emergency services because then something else might be wrong with the patient that they're not improving. Okay, so then, yeah, the prevention. So how to prevent something like this? Obviously with first-time patients. So like in our case, this was a first-time patient, so she ticked this box. We did give her a detailed explanation of the treatment, so that was fine. But I think the mistakes we made, or should I say the physio made, is that he used too many needles. The manipulation was too strong, because what happens is that electroacupuncture can be quite a strong manipulation, and especially for first-time patients or patients like this, it can be overwhelming. And then the fourth thing we found, which we didn't know until afterwards, was that the patient had skipped their breakfast, and it was about 11, so it wasn't that late, but they had skipped the breakfast. So I think it was a combination of all these factors that had caused this. And then the final thing you could do as a practitioner is be very vigilant of the signs of syncope. So lucky for us, she was making noises, but when you go to check on your patients, you can also look at their face and check the color of the skin and make sure they're not sweating or fidgeting. And this will also help you to identify it early, which fortunately we also managed to do. And the final thing is checking the blood pressure. We checked the blood pressure only afterwards and found out it was quite low, which would have helped us a lot if we had checked it before the treatment. Secondly, we will look at pain. So normally during acupuncture, there should be no pain experienced by the patient, but sometimes you need to be careful because patients are not always sure of the difference between pain and chi sensation, as they can be easily confused. So when a patient does tell you they are feeling pain, you must check whether it's chi sensation or pain. And the big difference is that the pain we're talking about here would be a sharp sensation. It would be close to the surface, and normally it's felt during insertion or during manipulation, whereas chi sensation is a much more deep felt sensation. It feels like someone's pressing or aching feeling, and it remains even once you release the needle. And then also you could combine that with your feeling of how the needle feels, and that will also give you an idea if they are feeling chi sensation. And then I've broken it down into 3 possible times when they could feel the pain. The first one during the insertion. So normally the cause here, the most common cause, is poor technique, which means you're not skilled enough to insert the needle without the patient feeling it. And this is normally assisted by using the guide tubes, which help to improve your technique. And then also, so what that means is that you are not going through the skin swiftly and efficiently so that the patient doesn't feel it, because normally all the nerves are in the skin, the upper layers of the skin, and if you get through this area quite quickly and swiftly, then the patient will not feel it. And that's why also things such as blunt needles or thicker needles means it's more likely for the patient to feel these, because obviously the blunt needles won't go in so smoothly and easily, and the thick needles are larger and therefore more likely to be felt. Management, most of the time that's not needed, as the pain subsides in a few seconds. But if after a minute or 2 the pain has not subsided, you have 2 options. The first one is to release the needle. What this means is we bring the needle back up to the upper layers of the skin, just in the subcutaneous level. So it's still in through the skin, but it's at the highest level. And then we check if the patient is still feeling the pain. If they are not, then we can try and reinsert the needle, not going as deep as before, and see how that goes. If they still feel the pain when you've retraced it, pulled it all the way up, then I would recommend removing the needle and not needling that point. And then how you prevent this from happening. Number one, the best way to do it is to improve your technique, a good technique, and then you won't have this problem. And the second way I say screening. What this means is that you must check with your patient before you start needling if they've had acupuncture before and how sensitive they are to pain. And even if they do have had acupuncture and they say they aren't sensitive, I would still, if it's the first time you are treating them, start with thinner needles, and then you can work your way up if they prove that they aren't very sensitive to the needles. So now let's look at pain after insertion. So what this means is that you have inserted the needle and now you're pushing the needle to the correct depth, and then you are leaving it, and you're just leaving it there without manipulation or touching it. And if the patient feels the pain when you are pushing the needle to the deep position, this indicates that you've most likely hit pain receptors and therefore have gone too deep. Or it might be pain when you manipulate the needle. This could also mean the same, that you've gone too deep and you're hitting pain receptors, or that there may be stuck needle. Or there might be pain when when it's just sitting there, you haven't even touched the needle, and this most likely is because the patient has moved and the needle has changed position. Okay, so what do we do if they're feeling this kind of pain? The best practice is to do the same as the previous. We lift the needle until it's just beneath the skin surface, and then we try and change the angle of insertion so that we do not hit those pain receptors. Or if we have stuck needle, then you'll refer to the protocol, which we'll discuss later on in the stuck needle management. And then also, if the patient is feeling the pain because they change position, then return them to the normal position, and then you'll refer to the bent needle management in that section of the slides on how to treat it. And then finally, if they're feeling the pain after withdrawal, then this most likely is caused because you've either done too excessive manipulation or you've done an unskilled form manipulation, and then it has caused damage to the tissue. And both of these things could cause stuck needle, which would mean it'd be difficult to withdraw the needle. And if you do have stuck needle, then we would refer to the stuck needle management section. Okay, and thirdly, we will talk about stuck needle. So the most common causes of stuck needle is nervousness, improper manipulation, which refers to doing the twirling method in only one direction. That's one improper manipulations. And then it can also occur if there's a spasm of the muscle or if the patient changes position. Yeah, and the changing position, patients can move a little bit during a treatment when the needles are inserted and they are in the retention phase. They can move slightly, but we try and tell them not to do excessive movements or rapid movements, as these can definitely cause this kind of condition. And in my own practice, I think all the times that has happened to me, most of the times it's happened because the patient has moved too much during the treatment. And once or twice because they were quite nervous and thus tensed the muscles. The manifestations, so they do vary, but the main thing is that when you try and manipulate the needle, you cannot manipulate it, or you cannot remove the needle. So it feels like the needle is stuck in place. There is different severities, so it could be just a little bit stuck and it starts slowly giving way, or it could be completely stuck and no matter how much you try to pull it, it wouldn't move. Okay. So what do we do when we find the needle is stuck? Well, firstly, you've got to keep your patient relaxed, because if they are not relaxed, they're going to make this worse. And then we have to determine the cause. So if it's from improper manipulation, like you rotated the needle in the opposite, like you rotated the needle only one direction, then if you rotate the needle in the opposite direction, it should release. Secondly, if it's due to a spasm of the muscle, then we either wait for the spasm to release, or we press near the area or massage near the area to help the muscle to release the spasm. And then if you think it's due to a change in position, so the patient is not in the position where you needled, return them to the position of needling and then try and remove the needle. Normally, if it is very mild stuck needle, then pressing or massaging around the area is normally enough to release it. Obviously, in more severe cases, you might need to massage and try again. If it's still stuck, wait, remove other needles and come back to it, and it should have released by then. But do not try and force the needle out, because if you do this, you could have the needle break, and that's a much more dangerous situation than the stuck needle. And if it's still not releasing, then we can insert needles near the problem area. This does two things. Firstly, it can help to relax the muscles, and secondly, it can make the patient less conscious of that needle. So how do we prevent this from happening in our practice? Firstly, you must keep your patients calm during the treatment and explain to them exactly what's going to happen. Secondly, having sufficient skill and knowledge in how to perform the procedures. This will prevent you doing improper manipulations or too strong manipulations and creating this kind of condition. And then thirdly, what we do is we inform the patient to not move too much during the retention phase of acupuncture. This is to keep this from happening. The fourth type of accident is called a hematoma. What this means is that this is bleeding due to damage to the blood vessels. And most commonly, this occurs when we insert an acupuncture needle and we hit one of the blood vessels. And then it could also be caused by not pressing the point after withdrawal. So you have hit the blood vessel, but if you remove the needle and you press on the point, this can help reduce the likelihood of a hematoma forming. And then how it manifests is most commonly it manifests as bruising. But in my clinical experience, I very seldom have patients that actually present like this. I've only really had one case where they've had a bruise like this one here, a big bruise like that. Sometimes they might have a small little bruise like the second one there, but most of the time there's not even bruising. And one of the clear warning signs is that once you remove the needle, it might bleed only a little bit, maybe not even bleed, but you will notice about 10 to 15 seconds after you remove the needle, the area is rapidly swelling up. If you see this, what you have to do is you have to quickly return to the area and press on it with an alcohol swab or a cotton wool bud, and you're going to press and hold for 1 to 2 minutes. This is to help break up the blood forming there and to reduce the risk of a bruise forming. And then management. So if you think during insertion that you've hit a blood vessel, then when you remove the needle, apply pressure immediately and hold there for at least 10 to 15 seconds, and maybe even up to 30 seconds to a minute, depending on the size of the blood vessel you have hit. Most of the time in the mild cases, they heal by themselves, not even having bruising or anything, just a small little, there might be like 1 or 2 drops of blood and then a little wound forms and a little scar, but it's normally so small that most patients won't even notice it. And then in severe cases, we can use things like a cold compress to help stop the bleeding, or we can massage and apply Moxibustion to the area to help disperse the blood stasis. And the key points here is in prevention is to make sure you have the proper knowledge. So if you know where the major arteries and blood vessels are all flow, then you can successfully avoid them. And also if you know about each individual point and what risks there are when using this point, this will also help you to avoid causing unnecessary damage or causing a hematoma to the patient. And then another key point in prevention is to press points after you remove the needle, but there are certain types of manipulation where we don't want to do this. So this is just a general guideline. If you think you have punctured a blood vessel, then press on the point. Next, we will look at bent needle. So bent needle is kind of like a more serious version of stuck needle. Sometimes it will happen without stuck needle, but most commonly it happens after stuck needle as a more severe form. And the possible causes, firstly, is unfamiliarity with anatomy. So what this means is you've kneeled in a point and you do not know that a certain movement when this needle is in is likely to bend the needles, or you've needled in a location which you need the patient to move to needle the next point, and therefore you cause the needle to bend on this movement. Secondly, unskilled manipulation. So what this means is that if you do the twirling method in only one direction, for instance, you can cause the needle to become stuck. And if this accompanied stuckness has a muscle contraction, it could cause the needle to bend. And then using inappropriate force, which is the same as the unskilled manipulation. If we use too much force, we could cause a muscle to go into spasm and therefore bend the needle. Also, if the patient moves suddenly or does a forceful movement, this can also cause the same effect. And then the final method is that the patient had a stuck needle and you did the improper management. So you either tried too forcefully to remove the needle, or you did not give time for the muscle spasm to relax, and this caused the needle to bend from muscle either contracting more or from your force. And then also under the the inappropriate use of force, it also refers to when you are needling. If your technique is not skillful, then what will happen is you might put the force in the wrong direction and you cause that needle to bend while you're inserting the needle. So that's also one key area to be aware of. The manifestations. So what the patient will present with is very similar to stuck needle. The needle will be difficult to move or manipulate, and there might even be pain when you try to manipulate or remove the needle. So that's the key difference, is there's pain. And then the other key thing to look for is that the needle has changed direction. So if you inserted it perpendicularly and now it's at a 45-degree angle, this is a warning sign. And then also if you're trying to remove the needle and you notice that it's starting to there's like a bend in the needle, that is also another warning sign. So then how do you treat this condition? Well, what you would do with a bent needle is the first thing you do is you do not try and manipulate the needle because of the funny angle it is at. If you do twirling manipulation, or you try and do lifting and thrusting, it's going to cause a lot of damage and pain. So we do not manipulate the needle. What we do is if the patient has moved position, we put them back to their original position, and then we lightly massage the area. So it's very similar as stuck needle, and that's to relax the muscle. And then we try and remove the needle slowly following the bend of the needle. This is to reduce the pain the patient feels. And then remember not to try to remove the needle forcefully, because this can also cause the needle to break, and that is much more dangerous than if the needle is bent. And then how do we prevent this? Well, firstly, you must have sufficient skill at manipulation. This is to prevent you from bending the needle on insertion, or from you to doing an incorrect manipulation that causes the needle to become stuck. Secondly, we must make sure our patient is in the appropriate position for the points we wish to needle, and that we won't need to make them move unnecessarily or too much during the treatment. And thirdly, we need to inform the patient that they shouldn't be moving after we have inserted the needle. And this is the same as the previous one. So that's why it's such a key point to inform your patient not to move, or not to move excessively. They can do mild movements and slow movements, but no excessive movements. And one thing this reminds me of, because when I experienced this, I had one patient also during my 4th year of practice that had bent needle. And what happened was, this one had nothing to do with the students or our technique or anything like this. This was actually to do with the patient. And what happened is that when we saw this patient and we were doing the consultation, this patient was very excited and very energetic and very loud and emotional when they were explaining their condition. And they kept standing up because they got so excited and carried on talking standing up. And considering we were all seated, this was very strange behavior. Anyway, we continued with the consultation, kept sitting and calming the patient. Then we told the patient to calm down, and it happened to be that the treatment was going to be for their knee. So we wished the patient to remain seated during the treatment. So what we did is then we started to do the needling, and then once the needling was finished and we had the patient just sitting there waiting, and they started talking again about their condition, they tried to stand up. And luckily we we were close by and we stopped them from standing, but they kept during the treatment trying to stand up. So what happened eventually is that they caused one of the needles to bend because they were moving too much, and this made it much more difficult for us to remove the needle, even though we removed it without any issues. But what the point of this is that one way to prevent the bent needle is to make sure you appropriately screen your patient in the form of their mental state. So like we talked about earlier in patient condition, if a patient is intoxicated, if they've had way too much to drink, then they are more likely to do things that would harm them. So that's why we would not acupuncture that patient, because they're more likely to move because they forget that we told them not to move, or that they forget where they are, or whatever is the reason why. The same is with certain conditions which cause the patient to maybe have a slightly altered mental state, like this patient, and that she forgot that she's meant to be seated and not moving, and then she would move and then she puts herself at risk. So in these conditions, we might have been better off putting the patient on the bed so that she couldn't sit up or stand up, or we would have been better, or a better option might have been to delay the treatment until she was in a state that was more suitable for acupuncture. So now we're looking at broken needle. So what this is referring to is that the needle has been inserted and then broken while it is inserted. And the possible causes for this is using poor quality needles, providing too strong a manipulation, a strong muscle spasm, which could be from the manipulations, or a sudden forceful movement of the patient, or trying too forcefully to remove a stuck needle or a bent needle. And the manifestations is that the needle body has broken during any phase of acupuncture, and the needle can either be broken above the skin surface or below the skin surface, and our treatment and management protocol will be changed according to this. And most commonly what happens is the needle will break either somewhere on the body, so that's from this section to this section, between that section, and most commonly it happens here, which is called the root of the needle, because that's where the two different parts of the needle are combined. So now that the needle has broken, what do we do? So firstly, you've got to keep your patient calm and still, because any movement could cause the needle to go deeper, and we don't want that. So what you would do is you would first assess the situation and see if the needle is above the skin surface or below the skin surface. If it is above the skin surface, what we normally do is we take a pair of forceps and we carefully grab the needle and pull it out. If it is below the skin surface, then what you'll have to do then is you'll have to send the patient immediately to the hospital and try to keep the area where the needle is located from moving, because this will cause the needle to go deeper, as most likely this patient will require surgery to remove the needle. And this condition is not very likely to happen as long as you follow the following prevention principles. Firstly, we do not insert the entire needle body below the skin surface. Secondly, we inspect all our needles for quality. Also make sure that you do appropriate and the correct manipulations. And we do not forcefully try to withdraw the needles when they are stuck. And if we look here at the needle, what we're talking about when we say do not insert the entire needle is, here is the needle over here, and here is the skin surface. So what we do is we insert the body, but we leave a small section of the body out, so that if the needle breaks at that common spot called the root, it is still above the skin surface, which allows us to still remove the needle if needed. So we never insert all the way until this portion here is all the way down to the skin, because then this means it would be more likely that when the needle broke, if it broke there, it would be below the skin surface. The seventh type of accident is called a local infection, and normally what this refers to is any invasion of a organism's body tissues by a disease-causing agent. And because acupuncture penetrates the skin surface, it can take pathogens through the skin surface and into the body's tissues. So that's why we have to be very careful when we provide acupuncture. And the most common causes of infection would be negligence in using proper aseptic techniques, the patient having a compromised immune system, or the patient having high blood glucose in conditions such as diabetes, where their glucose is naturally higher than normal. The manifestations, well, there will be local redness, heat, and swelling, and there may be pain at this area, and this area was a previous acupuncture point. Most of the time, if it does occur, it would be very mild, like on the left, very mild. It actually is not very common at all. The image on the right here is just to show you what a severe case would look like, and this is very unlikely from acupuncture. The only instance where this may happen is if you needle the patient with late or severe diabetes and the wound did not heal over many months. It could become like this. So that's why we've got to be very careful in our aseptic technique on these patients. So if this occurs, how do we manage it? So firstly, what we have to do is we have to determine the severity. If it is like on the left side, which is a mild case, then they most likely heal by themselves. But if it's more like this case on the right, which is considered a severe infection, what will happen is you'll have to refer the patient because they have to get a specialized treatment based on the cause of the infection, and therefore they will need special bandages and they will need to be swabbed and checked. So in these cases, we normally refer the patient. And then prevention, what we do is we make sure that we use a strict aseptic technique, and this will be discussed in further slides. And secondly, we screen our patients properly and identify risk factors such as diabetes or immune compromisation, so that we are more aware of the possible risks of infection for this patient. And then the 8th type of accident is convulsions. So this can occur either during the treatment, before the treatment, while the patient is in the waiting room, as it is not related to acupuncture treatment. It's normally caused by variable factors depending on the patient and depending on the cause of the disease. The manifestations also vary depending on the type of seizure, but common symptoms are that they cry out, they fall, they shake, they jerk, and they become unaware of what's going on around them. So this one's very unlikely to occur, but you need to know what to do if it does happen in your practice. So how would we manage this if it happened? So firstly, if they are busy in a treatment, you must remove all the needles immediately and remove any objects around them that they may hurt themselves on if they are jerking or having shaking. So like sharp objects or anything that they might knock and fall on themselves. If it's happening outside the treatment room, then we just help the patient to the floor and we remove away chairs or anything that they could bash themselves on. And then what you do from there is you call emergency services and you just keep the patient lying down until emergency services arrive. And then prevention. So there's not much you can do in prevention, but you can screen patients and see if they have a history of epilepsy or convulsions and find out if there are any factors that cause these episodes to occur. This will just help you not be the cause of the convulsions. Next, we will look at traumatic pneumothorax. And what this refers to is injury to the lung, normally a puncture by one of your needles that allows air to enter into the pleural space. And the most common causes is deep needling on points of the chest and back, or an incorrect angle of insertion on points of the chest and back. And the main manifestations are chest pain, dyspnea, coughing, tachycardia, shallow breathing, and cyanosis of the lips. And these symptoms can occur either abruptly during the manipulation, or they could occur over the next several hours after the acupuncture treatment. So how do we manage this condition? Well, what you have to do is you have to send your patient immediately to emergency services, as they need to be constantly monitored, as the mild cases normally resolve by themselves, but the severe cases will require surgery, and it can go from a mild case to a severe case quite rapidly, so they need to be monitored the entire time. And if they are presenting with severe symptoms at your practice, what you can do is you can do the first aid protocol for a sucking chest wound to help them out until the emergency services arrive. And then prevention. So the best way to prevent this is to have appropriate knowledge and focus when we are needling points on the chest and back. And this is a special emphasis on things like not inserting deep on the points, on these points, not performing perpendicular insertions, and not performing excessive manipulations, with special regard to the lifting and thrusting method, especially on points of the chest and back. Next, we will look at injury into important organs. So the causes for this one is normally an incorrect needling technique, deep insertions, the patient having enlarged organs such as hepatomegaly or splenomegaly, or performing excessive manipulation, most specifically regarding lifting and thrusting method. Then what would the patient manifest with? Well, there will be bleeding, local pain and tenderness of the infected organ. So if you hit the kidney, there will be lumbar region pain combined with hematuria. If it's the spleen, the pain will be in the left upper quadrant with left shoulder pain. If it's the liver, it'll be right upper quadrant pain with right shoulder pain. And then there will also be rigidity and guarding of the abdominal muscles. Then if you've damaged any part of the central nervous system, there will be specific symptoms, such as if you injure the medulla oblongata, there will be headache, nausea, vomiting, convulsions, and possible coma. And if you hit the spinal cord, what will be felt by the patient is there will be a lightning pain felt either in the extremities or below the point of insertion. So how would we manage this condition? Well, this condition requires imaging to diagnose the level of damage, and therefore we have to send the patient to an emergency care facility. Most often, in mild cases, this will heal by itself and will only require the patient to remain in the hospital for monitoring. The severe cases will often require surgery to reduce the bleeding. And so how do we prevent this from happening? One has to be careful when needling these points, and all points that pose this type of risk. These are all points that are near important vital organs. And then they must also adhere strictly to the guidelines given in the books regarding these points. Also, one must only do mild manipulations on these points. And finally, the practitioner needs to question the patients properly and palpate the liver and spleen when needling points around them. The last point we will talk about is slightly different from the others. This one is different because it's an injury that happens to the doctor or healthcare worker and not to the patient. And we consider it a sharp injury whenever a healthcare worker or doctor's skin integrity is broken by a used acupuncture instrument. And by a used acupuncture instrument, we are referring to either needles, plumb-Wasser needles, the 3-edge needles, any of these items that have been used on a patient and have pierced the patient's skin. Other ways this can occur is also from body fluid or blood splash onto a mucous membrane of the doctor, or body fluids and blood contact with any wound on the doctor or his healthcare workers. So this can be coming into contact with a swab of blood or an alcohol swab or even a soiled piece of linen. So how do we prevent this? Well, what we do is we take special care with all our used needles and soiled equipment. The used needles need to be put into a special container called a sharp spin, which prevents and reduces the risk of the needles accidentally injuring one of your staff or yourself. And then the soiled equipment we need to remove as soon as it becomes soil, and we need to wear the appropriate PPE when removing it. And then finally, we must also wear the appropriate PPE, which PPE stands for protective equipment, personal protective equipment, and that we must wear the appropriate one for the treatment procedures we are about to give. And then how do we manage it if we do become exposed to any of these factors? Firstly, you need to clean the wound under running water immediately. Then you need to disinfect the wound and cover it with the dressing. If the splash occurred into one of your mucous membranes or your eyes, you need to rinse it with water or a normal saline solution. And then what you have to do is you have to perform risk assessments by checking the HBV, the HCV, So that's hepatitis B and hepatitis C, and the HIV status of the blood source, which means whoever the patient was that the needle was from, or that the blood swab was from. If you are in doubt, then you would have to have either the blood tested or have your own blood tested, and it will require follow-up testing.